and then we'll begin. Dr. Vanderhoff. Okay, Dr. Vanderhoff, thank you very much. If you would like to begin, I would greatly appreciate that.
Terrific. Thank you very much. Good morning. I'm Dr. Bruce Vanderhoff, the Chief Medical Officer for the Ohio Department of Health. And I want to begin by sharing that today, June 2nd, 2021, has turned a page in Ohio's battle against the COVID-19 pandemic. We fought hard, and more than 5.3 million Ohioans have made the choice to receive the COVID-19 vaccines. And as Governor DeWine promised 3 weeks ago, the pandemic health orders have been lifted. Starting today, masking and social distancing will no longer be required in Ohio. Yes, these orders have been lifted, but not because there is no threat of COVID-19, not because that threat has passed, but because the progress we've made with vaccination makes it appropriate to shift the responsibility from government mandates to the hands of the people of Ohio. Businesses, workplaces, and schools are permitted to continue to require masking or social distancing at their discretion to keep customers, employees, and students safe. When businesses or workplaces don't have a masking requirement, some Ohioans may also choose to continue to wear a mask or practice social distancing. And the CDC continues to require masking in certain circumstances, regardless of whether someone is fully vaccinated, including in healthcare settings and when traveling on planes, buses, trains, and other forms of public transportation. Now, while not required, those who have not been fully vaccinated should continue to wear masks, especially indoors. If someone isn't vaccinated, they simply don't have the same level of protection as the rest of us who are vaccinated. And the best protection, aside from COVID-19 vaccines for them, is to wear a mask and practice social distancing. Although the health orders have been lifted and we've turned another page in our battle against COVID-19, we need to remember that the threat of the virus remains. And as I've said before, vaccines are our best protection against the virus. Thankfully, Ohioans 12 and older can make the choice to receive that protection by getting the COVID-19 vaccine. While more than 5.3 million Ohioans, as I noted before, have in fact been vaccinated, there are many who have yet to be vaccinated, either by choice or because they can't. In addition to the small percentage of people who can't be vaccinated for medical reasons, we need to remember that there simply isn't yet a vaccine authorized for the youngest Ohioans, those age 11 and younger. Fortunately, most of us have access to the COVID-19 vaccines, and these vaccines are incredibly safe and effective. Now, joining me today to talk about the safety and efficacy of vaccines for those 12 and up and how we can keep those ages 11 and younger safe as well is Dr. Patty Manning-Courtney, Chief of Staff and Professor of Pediatrics at Cincinnati Children's Hospital. Dr. Manning-Courtney, can you tell us a little bit about the safety and efficacy of the COVID-19 vaccines for those who are ages 12 and up?
Absolutely. Thanks, Dr. Vanderhoff. We're really fortunate here at Cincinnati Children's to have had a front row seat to the safety and efficacy of the Pfizer vaccine because our researchers were directly involved in the clinical trials of this vaccine. And so it was the children in our own neighborhoods and our own communities who participated in these trials, thousands of children who participated and demonstrated both the safety and the efficacy of the COVID-19 vaccine. The children who received the actual vaccine didn't get COVID. The children who received placebo, a small number of them did get COVID. But of the thousands that did receive the vaccine as part of the study, we did not have any serious adverse events or negative outcomes in that population.
Excellent. Can you tell us a little bit more about how we should be approaching children who are 11 or younger and can't yet be vaccinated? What can their parents do? What can we as Ohioans do to help protect them?
So, every day in our hospital where we have over 500 children admitted, we have a handful of children with COVID in our hospital, including today. And the thing that you can do to protect those children who can't be protected is you can get protection. You can get vaccinated. That's the number one thing you can do. If you don't get COVID, if your chance of getting COVID is greatly reduced, you won't transmit it to children who are vulnerable. And some of those children who are vulnerable have other illnesses. They have cancer, they have organ transplants, they have chronic diseases, and we want to keep them safe. You can also practice the safe practices that we want to encourage. If you're not vaccinated, you can wear a mask. If you have a child who can't be vaccinated, we would encourage you to wear a mask because it seems sort of unfair to have children wearing masks, but have the adults in their lives not wearing masks. You can practice good hand hygiene. You can avoid crowds. You can practice social distancing. You can do the things that we've talked about all along to keep those children in your lives safe.
Well, thank you, Dr. Manning Courtney. Very helpful. A recent article in National Geographic addressed the concern that there could be localized pockets of COVID-19 cases that could be the result of lower vaccination rates in some communities. The bottom line is that the more Ohioans who are vaccinated, the more we can protect ourselves and one another. Also joining me today is Dr. Jeffrey Swartz, a family medicine physician specializing in geriatrics at Mercy Health Waterville Family Medicine. Our data shows that 1 in 5 Ohioans aged 65 and older have not yet started the vaccination process. Although the rates of vaccination are high in this age group, unvaccinated individuals 65 and older are at high risk for complications from COVID-19. Dr. Swartz, why is it important for older Ohioans to be vaccinated?
I think for a lot of the reasons that have been mentioned, also for the pediatric population, applies especially to our older adults that have some chronic conditions that put them more susceptible to have a bad reaction and a bad course with the viral illness. I think it's unfortunate that, some folks hear about a friend that had a bad reaction or supposed bad reaction, and then it spreads like wildfire. And I think it's incumbent on us, on we physicians, to help to correct that and sit down and talk to our patients about the risk-benefit ratio of getting the vaccine. And also, what is the risk of not getting the vaccine, which I don't think people necessarily appreciate when they listen to this maybe misinformation that's out there.
Yeah, thank you, Dr. Swartz. And as you note, while people can experience some side effects from the COVID-19 vaccines, certainly not everyone does. And for those who do, symptoms are often transient and really represent the body's natural immune response. And I agree with you completely. That's far less concerning or severe than the damage the COVID-19 virus itself could cause. So I would join you in urging all Ohioans who are eligible to choose to get the COVID-19 vaccine. I also want to reiterate something that both physicians are alluding to, and that is, look, the virus isn't gone. We need to remain vigilant, and the best protection we have are these vaccines. So the more people, the more Ohioans who choose to get vaccinated, the better off we all are, including the people who are not yet eligible to get the vaccine. While those who aren't vaccinated won't be required to wear a mask, they should still consider wearing a mask, or better yet, should think about getting a vaccine. So let's take some questions now. Alicia, who's our first question?
Thank you, Dr. Vanderhoff. Our first question is from Joe Ingalls with Ohio Public Radio and Television.
Thanks to all of you for doing this. I would like to ask about breakthrough COVID. We have a lot of people who think, oh, I have the vaccine, I can go out, I can just live life as I normally did before COVID even came into the picture. And they are not worried about breakthrough COVID. How worried should people be about breakthrough COVID, and how prevalent is it in Ohio?
Well, let me field that, and then my colleagues can jump in if they have additional information. Fortunately, these vaccines are proving to be very, very effective in the real world. And both nationally and here in Ohio, we're seeing vanishingly low numbers of breakthrough hospitalizations and deaths among people who've been vaccinated against COVID-19. So I don't think that they need to be particularly concerned about breakthrough. What I do think they need to be remembering, though, is that vaccines, while very, very good, have never been and will never be 100%. There are a lot of factors involved with the response to a vaccine, including your own immune system's response. So my particular caution would be to those who might have conditions that have affected their immune systems, and they need to be particularly careful. I would still, in most cases, as long as their doctor agrees, strongly advocate for receiving a vaccine, but also advocate for some additional caution on top of that because of the unknown, the unpredictable question of how their own immune system will kick in. And so for them, perhaps continued masking and social distancing would be prudent. I'll turn to my colleagues and see if they would add anything to that.
So I think that I've heard of some breakthrough, but it's been very isolated. And again, that runs like wildfire with the patients. You know, my cousin's housekeeper had the vaccine and she got the virus anyway. But again, I think it's about talking with your doc and having a good relationship, that you handle these questions and focus on, you know, you want a 90% solution, or do you want to go out and kind of take that risk? I also think that it's incumbent on us that we've tried to really teach some good health practices, you know, the hand washing, the masking, and being careful in crowds. I think that's important to continue, but also doing things with our nutrition and maybe some simple supplements in cases that help our immunity be optimized to help to fight off all viruses. So I hope that something that comes out of this pandemic is that we're all going to maybe have some lifestyle modification to be healthier such that we can handle the next crisis if it comes up.
I'll just add that we've had a very low number of breakthrough COVID cases amongst vaccinated employees. And fortunately, those individuals do not get very ill. But to the points made earlier, the vaccine isn't 100%. You can still be careful. I don't think it's something that people should have front of mind all the time, but they should be cognizant of the other people in their lives who might not be as well protected.
Thank you, doctors. Our next question comes from John London with WLWT News 5.
Yes, it's good to hear from all of you about this. Dr. Manning, you know, Dr. Vanderhoff made the point that the virus is not gone, but, you know, the orders are gone. And there's a real relaxed mood when we're out there talking to people. And I wonder if you would talk for a moment about when and where you think children should be masked out in society, and what, if you have any working guidelines for parents. I know they're interested about children over the summer as these, you know, restrictions are no longer in place.
A great question, John. Thank you. You know, our working guidelines have been pretty straightforward. If you're not vaccinated, you need to wear a mask when you're out, and that includes many, many children. We know that impacts their ability to participate in activities like camp and outdoor activities. And we've been we've recognized that children who are very physically active and playing sports or involved in swimming or something like that certainly don't need to be masked. But when they're out in crowds, out in public, out in stores, out at events, they should be masked. And we're of the belief that parents should mask and family members should mask along with them. It's just the only way to protect that population. We all know that COVID has not been as serious in kids as it's been in adults, but it has been serious in some kids. And there's no guarantee that that wouldn't be your child who gets more serious COVID.
Thank you, Dr. Manning Courtney. Our next question comes from Courtney Wheaton with Local 12.
Hi, thank you for taking my question. Some of our lawmakers, maybe out of excitement, have posted videos actually showing them burning their masks. Do you think that is the right messaging so early in this fight and with so many unvaccinated Ohioans still out there?
Well, I can understand the excitement or the enthusiasm that any of us might feel at having reached a point in the pandemic where mask mandates are able to be lifted. However, I do think that the caution you've heard all of us express about relaxing our guard too much about COVID-19 and its continuing threat needs to be heeded as well. Look, the best protection any of us can achieve is to develop the immunity that is given us by these vaccines. We're very blessed to have such effective, such safe vaccines against COVID-19. And I think what you hear is we're strongly encouraging people to line up and get that shot. But to the extent that people are not able or not willing to receive a vaccine, they really owe it to themselves and the people they care about to consider masking and distancing when they're around others. So I think that's our simple message. I'll turn it to my colleagues to see if they have anything they'd add.
Well,
Go ahead.
Go ahead.
I would just say that, masks, it's unfortunate that masks and the mandates with masks have been equated with, taking away people's rights to do what they want to do. I will say in healthcare that wearing masks has been a long-standing practice to keep everyone safe. We've learned a lot about mask wearing this year. We've seen dramatically reduced rates of other respiratory diseases. Fewer children have died from things like flu or RSV because we wore masks as a society and as a healthcare system. So I regret any message that kind of conveys that mask wearing is bad. Yeah, we're excited to take our masks off, but there will always be a time and a place for good, safe practices like wearing masks.
So I agree totally with that. And I was just going to say, some folks are symptomatic with allergies, some have other viruses, and sometimes it's difficult to know. So kind of good common sense would say, wear a mask and protect others and protect yourself. And if there's a chance that you're sick, stay in. Even now with the diminishing COVID, use good common sense.
Thank you, doctors. Our next question comes from Dan DeRose with WOIO.
Good morning to everyone. Dr. Vanderhoff, it appears that the excitement, as the governor put it, around the Vaccimillions is already starting to wane. The number of people getting vaccinated in this past week are pretty low. Granted, we were looking at a holiday weekend. 45% of Ohioans have started the vaccine process. Only 40% have completed it. That is nowhere near what the nation is doing as we approach 70% starting nationwide. Are you baffled by this? Why is Ohio so far behind the curve when we know there are so many places you can just walk in and get the vaccine?
Well, actually, I'm encouraged by what we are currently seeing and encouraged by the impact that Vaccimillion has had and continues to have. I think it's premature to look at our numbers coming out of a holiday weekend to make much in the way of conclusions. But the numbers that I looked at, particularly among those, among those who are in the 12 to 21 bracket, really seem to continue to be encouraging. The other thing that I would say is that we do have more opportunity, and we all need to take that very, very seriously, but I'm far from discouraged. Dr. Manning Courtney or Dr. Swartz?
I would echo the sentiment that, you know, we have a ways to go, but I'm very encouraged by the progress we've made. I'm very encouraged by the enthusiasm of the children we've seen. We have vaccinated over 2,000 12 to 15-year-olds in the few weeks that we've been able to vaccinate that age group. And that group, you know, they've been ambassadors. They've sometimes brought in their family members who've been a little bit more hesitant. And so I think the pace may go down, but I am very optimistic that Ohioans know what to do to be safe and to protect each other.
I think that's true as well. And I think we're in a great place in our state where anyone who wants to get vaccinated can, because the vaccine is available, which is fantastic. And it's great to see. We just have to encourage and kind of have a united front about how important it is to get vaccinated to totally or nearly totally wipe this pandemic out.
Our next question comes from Terry DeMio with the Cincinnati Enquirer. Terry?
Hi, everyone. Well, you somewhat answered my question, Dr. Manning Courtney, but I was going to ask what had been the response from the parents of these children who are now able to get vaccinated, and how important it is that these children get vaccinated before, you know, the fall academic year begins.
Well, we've seen parents who, as soon as we opened up our phone lines, they made an appointment to schedule their 12 to 15-year-old. We've had people show up on their birthday, their 12th birthday, to get vaccinated. So some parents have been so excited about this opportunity. And I think that really speaks to the recognition of why we want children to get vaccinated, and something I didn't get to say earlier, but that I'd like to share. And that is, you know, there are three reasons for kids to get vaccinated. One is to protect them. They, as I said, could get COVID, might get COVID more severely. We can't promise anybody that that wouldn't happen. The second reason, and this is something we've seen in the parents of children, the second reason for kids to get vaccinated is it protects the other vulnerable adults in their lives, their grandparents, their aunts and uncles, their family members who might not be able to be vaccinated, or for whom the vaccine doesn't provide sufficient protection because of immune system differences, as you've already heard. And they want to be around those family members. And then the third reason, and this is an important reason that we've seen from parents as well, parents who recognize that vaccinating children contributes to that societal protection that we're seeking. We call it herd immunity or community immunity. What it really is how we protect ourselves as a society, and specifically how we protect ourselves from variants. We are one variant away from COVID being more serious in children. There's no way to predict that the next variant, which will develop if disease is swirling around, that variant couldn't be more harmful to children. It could. And so vaccinating children reduces the rate of disease swirling around our community and reduces the rate of the development of transmission. And all that relates to what happens in the fall when kids go back to school. Kids have really, despite not getting as sick from COVID, they have really borne a specific burden from COVID, in that their lives have been disrupted in ways that we've talked about many times, school and activities. And so being able to protect them and send them back and protect their teachers and protect their teachers' family members through vaccination is really critical. We don't want to see, again, disease start swirling around, as it often does when kids go back to school. We want to really squash the rates of disease. And the way to do that is vaccinating as many kids as possible.
Thank you.
Our next question comes from Jim Province with The Blade.
Good morning. Dr. Vanderhoff, a lot of what we're hearing this morning is the same message that you've been delivering for the last 6 months. Can you give us an idea why this does not seem to resonate with some members of the Ohio populace?
Well, you know, anytime that we are talking about any health measure, it can take a while for that to for the uptake to carry out. And that's certainly true for vaccines. one of the challenges that we have with most vaccines, although we're working on addressing this, is, it does involve a needle. And one thing is that many people would just rather avoid having a needle stuck in their arms. So I think this is really about helping more and more Ohioans to understand the importance that this vaccine offers them personally. And as Dr. Manning Courtney, I think, outlined very nicely, but also how it is important for those who they care about, who they're around, and how it's important for all of us together. And all three of those are important elements here. These vaccines are really just remarkable. As a physician, I look at these, and having worked with vaccines my entire career, I am incredibly impressed by these particular vaccines. Their effectiveness is remarkable, their safety is remarkable, and their availability is remarkable. Let's keep in mind, these are vaccines that are highly effective at protecting you for the most serious outcomes. Essentially, you get this vaccine and you are eliminating statistically your risk of ending up in a hospital or dying from COVID-19. And then you add to that, these vaccines are free. Yes, it's true, if you have insurance, they'll ask you for insurance information so they can bill your insurance. But if you don't have insurance, you don't have to pay for these vaccines. So we have free vaccines that work very well and are incredibly safe. We will continue to see people rolling up their sleeves and getting this vaccine. What we want to see, though, is that happen as fast as possible. And let's not forget that in a mere matter of months, over 5 million Ohioans have done just that. So it's a remarkable achievement, more to do, but let's not forget the achievement that has been attained thus far.
Thank you, Dr. Vanderhoff. Our next question comes from Adrienne Robbins with NBC4.
Hi, Dr. Vanderhoff. Thank you for doing this today. I understand you may not be concerned at this point, at least about our vaccination rates, but we are behind at least 25 other states, pretty far behind. What do you think is going to change between now and the next couple months to get that number of Ohioans to roll up their sleeves? The state's already offering $1 million. Health orders are being lifted. What more can be done to get these people who have waited to get vaccinated?
Well, I think that the message of today is that the responsibility is now all of ours. As a state, we are doing all that we can to responsibly get vaccines out to communities, into physicians' offices, in just a countless variety of venues. The opportunity is there for everyone now. In fact, most places that I've visited are now offering walk-up vaccination as opportunities. So the opportunity is there, the safety is there, the efficacy is there, the vaccines are free. It's now our responsibility as Ohioans. We need to do this, and the responsibility for our vaccination rates rests with each and every one of us.
Thank you, Dr. Vanderhoff. Our next question comes from Tom Jackson with the Sandusky Register. Tom?
Hi, Dr. Vanderhoff. You've been emphasizing how well the COVID vaccines work. Can you offer a comparison between the COVID vaccines and recent flu vaccines? Because I understand that the COVID vaccines are quite a bit more effective than many of the familiar vaccines that we've been putting in our arms in recent years.
Yes, that's a very good comparison, and I'm happy to help illustrate that. So as we look at the trials of these vaccines, we're seeing reported efficacy rates in the neighborhood of 95%, give or take. In subsets of populations, we've even seen vaccination efficacy rates that are higher than that. Contrast that with what we would see with a typical year with a flu vaccine, where we may be looking at something in the neighborhood of 40 to 50% vaccine efficacy, and may not be seeing the same dramatic impact on eliminating risks, let's say, of hospitalization. So we've got vaccines that are really stunning in their efficacy, vaccines that we should all be incredibly proud to have had developed right here in the United States and now available to the people of not only the country, but Ohio.
Our next question comes from Alexis Moberger with ABC6.
Can you hear me okay?
Yes, we can.
Great. Okay, so my question is, with the Vaccimillion, is it helping vaccination rates here in the state of Ohio? And is it, if so, is it the boost that you were hoping for? And also, is there a certain demographic or age group that these type of incentives are working for?
Well, there's no question that Vaccimillion has had a very favorable impact on vaccination here in the state of Ohio. Prior to the launch of that effort, we had a progressively downward trend in vaccination rates in the state. And by the way, we were seeing similarly declining vaccination rates across the country. After the introduction of Vaccimillion, Ohio's vaccine rates began to climb again, in contrast to their previous trajectory and that observed in many other states. So very favorable impact. We're really glad for that impact because look, what are we aiming for at the end of the day? The goal at the end of the day is to keep people safe. The goal is to keep people healthy, to save lives, to keep people out of hospitals. And the way to do that is to get more people vaccinated.
Our next question comes from Jake Zuckerman with Ohio Capital Journal. Jake?
Hi, this is for Dr. Vanderhoff or any of the physicians on the panel. House Bill 248 is up for a hearing next week. The bill would weaken state vaccination laws. It would take away the ability of institutions like schools, hospitals, and others to mandate or incentivize vaccination from employees, students, or others. Do you have any thoughts on this idea?
Well, I'll begin and then I'll allow my colleagues to comment on vaccination. You know, vaccination has been and will continue to be a very important part of every physician's effort to improve population health. The fact is that vaccination is a unique tool because what it allows is for us to protect someone from ever developing a disease. So many of the other tools that we have involve treating a disease after it's already begun or it's already underway. Whereas vaccines allow us to actually put a protective bubble around a patient to either substantially reduce their risk or eliminate their risk of contracting something that can cause all kinds of other health issues and problems. So you'll find that most physicians are strong vaccine advocates and would discourage moves to weaken either access to or incentives to receive vaccination. I don't know, Dr. Manning Courtney, as a pediatrician, if you've got any additional insights or thoughts.
Sure, thank you. Well, yeah, as a pediatrician, vaccines are the mainstay of how not only we keep children healthy, but how we keep them alive. And I'll be very direct and say that this bill threatens how we take care of children and how we keep them healthy and how we keep them alive. To limit and restrict the ability to require vaccinations in schools or to check vaccination status it's pretty, it's almost unthinkable in a pediatric community to think that one of the best tools that we have at prevention would be limited or restricted or, discussed in a way that is negative when it's been such a positive in pediatric healthcare. The other thing about HB 248 is the limitation around mask mandates, which again, in a healthcare setting, I can't imagine not being able to employ a tool that is as basic as a mask. To me, it's almost akin to saying, oh, and you're also not allowed to wash your hands. I mean, we would never think that way. So we stand in opposition to HB 248 because of the really significant negative impact that we think that it would have on child health.
I was very much surprised when I came back to Ohio after my stint in South Carolina and coming back to University at Bowling Green to learn that there was no mandate for vaccinations on entrance to a state college. I was very surprised, and that caused, obviously some problems when we would have an outbreak of something that we, even mumps, we had mumps and rubella we were talking about with some students. And I said, folks are all vaccinated. Well, I found out that wasn't necessarily the case. So, yeah, I think it really causes a crisis. And of course, if you're as old as me, I remember getting mandatory smallpox vaccine, I think at the fire department, and I think I got my Salk polio vaccine at school. So, but those things have changed over the years. And again, I'm with you. I'm against that. I think we need those mandates. Makes sense. Makes good logical science,
Thank you
To
very
Dr.
much.
Vanderhoff, I didn't quite hear an answer from you. I mean, I heard general statements in support of vaccines, but you are the ranking physician in the state. Do you have no position on this time?
I think that my colleagues have covered the territory quite well.
Our next question is from Noah Blundo with Hannah News.
Good morning. Thank you. I'm wondering what you can tell us about the follow-through rate right now for people who start the vaccination process, how often they are completing it, and what that will say about the overall level of protection. Thank you.
Yeah, so I don't have the statistics that I can quote you right in front of me, but I do monitor that fairly regularly. And thankfully, the vast majority of people who begin their vaccinations, complete their vaccinations as they get their second vaccine, their second dose. There is a small percentage where that does not appear to happen. One of the things we don't know is that because they're going elsewhere? Are they beginning their vaccine? Let's say they're a college student here in Ohio and completing it in another state. Are they somebody who is perhaps living part of the year here in Ohio and part of the year in another state? So we don't have a real clarity on that, but it certainly does appear that the vast majority are getting their second dose. So I think that message has been received loud and clear.
Our next question is from John Reed with Gongwer.
Good morning, doctors. What advice do you have for business owners and other people who now might still have a mask mandate, but because there's no health order, they're going to be dealing with customers coming in and saying, you can't make me wear a mask because there's no state order, things like that. What advice do you guys have for dealing with that scenario now?
Well, I think it's absolutely true that without a mask order, businesses will really not be in a position to enforce a mandate. They won't be able to make it. There's no way to distinguish those who have and have not been vaccinated as they're entering their store. However, I have seen a number of stores that I think very responsibly continue to post signage requesting that people who have not been vaccinated wear a mask when they're in the store. And I've seen that evidenced in their approach to their own staff. So I've noted that there are staff within the stores who continue to wear masks. And I think that sends a very responsible message.
Our next question is from Amy Steigerwald with WTOL.
Hello, I have a question regarding traveling. A lot of families are probably planning summer vacations with children who are not eligible to get the vaccine. Is there any concern with them kind of going to different states and that may not be doing as well as Ohio and bringing that disease back here?
Well, I think fortunately, and I'll be interested in the reflections of my colleagues as well, but I think fortunately they can apply the same guidance that we're offering here in Ohio to the other places that they would be visiting. Look, if you're not vaccinated, COVID-19 is still out and it's everywhere. And not only is it COVID-19, but across the United States, just as here in Ohio, the B117 variant, which is known to be much more contagious, is the dominant variant. And that is largely true regardless of where you would be traveling to in the United States. The best protection they can offer their children is to encourage them to wear a mask and maintain appropriate distance when they are around other people. So that's the best advice. Again, Dr. Manning Courtney is a pediatrician, and I don't know if she would have any additional thoughts in that regard, or my other colleague, Dr. Swartz, who's a family doctor.
I think you hit the nail on the head. We have not had to communicate about certain areas that are more concerning domestically for many months now. At the beginning of the pandemic, that was different. And the tactics that you can use here to be safe apply wherever you might travel domestically. I think we should take an opportunity to give kids a shout out right now because they've actually been really good at wearing masks. A year ago-ish, we were talking about, oh, can kids wear masks? Should we require that? And I have to say on any given day, I see hundreds of kids here at the hospital wearing masks, not complaining, wearing them correctly. And it's inspiring personally to see that. International travel might be another conversation. If a family was going to travel internationally, I think that would be a very important point at which to look what disease was like in different countries. But domestically, I would not have concerns as long as safe practices are followed.
I agree completely, really nothing to add. I think this is the time when we're starting to see our grandkids and our kids out of state, and so we're getting some cross exposure with things. And I think it's important to, again, use common sense and be logical with this. So.
Thank you, doctors. Our next question comes from Peter Grieve with Spectrum. Peter?
Hey, good morning. I have a couple questions about sort of the end of the health orders. Just quickly, first, can you provide an update on whether the state of emergency is going to be ended? Second, can you provide an update on the order as far as long-term care facilities, and will masks be required in assisted living as well as nursing homes? And then lastly, just wondering if you could provide some clarity on public transportation and hospitals. Are masks going to be required by the state in those settings, or is that up to those sectors and the companies in those sectors to decide?
Yeah, I'll field this. So in terms of the state of emergency, that is a question I'm going to have to defer on or pass on. I don't have anything to share or announce today on that. Secondly, as it relates to issues around public transportation, the healthcare sector, the CDC continues to offer guidance regarding those that requires masking, largely requires masking and distancing as continued best practices. You know that many of our hospitals and healthcare institutions are accredited by CMS, and so therefore continue to be accountable to federal requirements and guidelines, regardless of what the state does or doesn't have in place. So you will continue to find, I'm sure, that healthcare environments continue to have expectations or requirements for masking in many of the parts of the hospital that you would see, especially the areas where patients are being cared for. Transportation, at least on a national level, will, for example, if you go on an air flight, you will continue to see a requirement for masking and other forms of transportation. I think will be encouraged to refer to the CDC for guidance. Though, again, in the state of Ohio, there will not be any mandate or requirement in place. Finally, as it relates to our nursing homes, the orders that are lifted as of today do not include the current orders that are in place for nursing homes. And keep in mind that nursing homes are very different environments. We're caring for some of the most vulnerable people. You may recall that our mortality rates and hospitalization rates in nursing homes earlier in the pandemic that was the population most profoundly impacted by COVID-19. And so they really do represent a special case and a situation in which vulnerable Ohioans are receiving health care. And so these lifted orders today do not include the nursing homes.
Thank you, Dr. Vanderhoff. Our next question is from Drew Simon with WHIO.
Yeah, this is a question really for everyone. Based on your interactions with the public, do you believe that there is a sizable portion out there of the unvaccinated population in Ohio that is actually waiting for full FDA approval on these vaccines before getting the shot? And also, now that the majority of the health orders have been lifted, what will it take for the state to officially declare victory over COVID?
Well, let me begin. I really don't know if moving from an EUA to the more traditional FDA approval will or will not have an impact on public perception or interest in the vaccines. I will tell you this, there continue to be a number of myths about vaccines that I think we need to dispel. And I think that all of you can really play a very important role in helping us to dispel. Some of those myths include, of course, that the vaccine is anything but free. No, the vaccine is free. No one needs to pay out of their pocket to receive a vaccine. Another is that the vaccines could adversely affect a person's fertility. And that is patently false. We've now been able to study this vaccine in millions of people, and that is not the case. Another myth that is out there is that the vaccines will alter your DNA. And I can just assure you, and my colleagues can, I hope, validate this. Look, from a medical science point of view, there is absolutely no mechanism by which an mRNA vaccine could in any way affect your DNA, your nuclear DNA. It just isn't going to happen. So the answer to that is no. We need to reinforce for people that these vaccines were not developed in a rushed manner. These vaccines were long already in development when COVID hit, and we were able to redirect years of research away from what they were being developed for, which was influenza and rabies and some other viruses, toward where they were more needed, which was for COVID. Yes, they are remarkable advances. Yes, they are incredibly effective. But no, they were not rushed. And the trials that allowed for them to gain initial approval were some of the largest trials ever in history. And now, of course, with the hundreds of millions of doses that have been given in the United States, we're pretty confident in these vaccines. So that's the messaging that I think we need your help getting out to people about the vaccines. Yes, it'll be wonderful to see when they receive that final stamp, which is formal approval. But honestly, that's a nice milestone, but from a medical point of view, not a particularly significant one. Doctors, I don't know if you have anything you would add.
Go ahead.
Go ahead.
I was just going to add, I am a developmental pediatrician by training, which means I work exclusively with children with disabilities and specifically children with autism. And in the late 90s and early 2000s, many of you are aware that there was a very active vaccine story around vaccines causing autism. Never was true, never was proven. But the damage from that vaccine myth, I think, lives on, even though that's not as often referenced that vaccines cause autism. I think it created a platform of distrust and skepticism around vaccines that has permeated and continued and was leveraged by the folks who want to leverage that kind of information around vaccines. And so it just disheartens me that, as has been said previously, that something that's free, that's safe, that's effective, that can protect you and save your life and save the lives of people that you love, that there would be so much hesitancy around that. Having said that, I think there are people who just need more time. And I am good with giving people more time. I mean, I worry about the effect it might have on their health and safety, but I have great respect for people who take this decision seriously. They want time, they want to understand, they want to see their friends and family members get vaccinated and be safe, and they'll get there. And sometimes what we need is patience and to give people the time that they need while protecting them as much as we can.
So I think, we're in the information age, and, it used to be you go in and see a patient 20 or 25 years ago, and you could kind of start at square one. And so sometimes there's this reorientation about the information that's out there, and, it's really heavy with social media. And I think what Dr. Vanderhoff said, and those 3 or 4 different points, I've been asked those questions by patients directly. I also think your point that some people are making a conscious decision just to sit and wait and see how things settle out makes sense. I also think that some of those folks are waiting for the herd immunity. And if the herd immunity takes over, I won't have to take the risk of having the vaccine. But to answer the original question with this, I think the more facts that we get out in a consistent manner, these are the facts. The vaccine came through fast, but has been worked on for years. No clinical trials were compromised. It's safe, effective, and free. How could you ask for anything more? Just get her done.
Thank you, doctors. Our final question is from Bree Malaska with NBC 24.
Doctors, thank you so much for taking our questions. I guess this would be for Dr. Vanderhoff, or whoever wants to answer, just how the state is preparing for a possible spike in cases with those orders lifting today.
Well, we continue to maintain all of the surveillance mechanisms that we've had in place throughout the pandemic in terms of being able to watch for any indication that there would be another surge in cases. The good news is that the experience in Ohio of case decline is being mirrored in much of the rest of the country. So that is an encouraging fact. And we continue to see more vaccine going into arms. That's the really encouraging fact. And so I think that what all of us can do to help assure that we don't see another surge, that we don't see cases begin to rise again, is to all be ambassadors for the vaccine. Clearly, it is the vaccine that is pulling us out of this. All we have to do is look at the past experience of the United Kingdom as they dealt with B117, or look at what's currently happening tragically currently in India, dealing with variants including B117, to know that without our current rates of vaccination, it's almost certain we would be dealing with a similarly difficult situation of large hospital case numbers, large death numbers, rather than the declines that we're seeing at this time. But we're not yet at protective population immunity or herd immunity. There's more work to be done if we want to continue to enjoy the good situation that we're experiencing. It's going to be really important for more Ohioans to roll up their sleeve and get their shot. Colleagues, I don't know if you'd add anything to that.
Agree completely.
Yeah, I have nothing to add other than, as hospitals, we stand ready. We hope to not have to be as ready as we were over the winter months when numbers were so concerning. I don't ever want to return to that experience. I do think vaccination rates, even as they are right now, will help that, but we stand ready if needed.
Absolutely.
Well, thank you all very much.
Thank you. Dr. Vanderhoff, we missed the latter portion of Drew Simon's question.
Okay.
That the majority of the health orders have been lifted. What will it take for the state to declare victory over COVID?
Well, I think that what we're going to continue to watch is as we head into the fall, will we achieve sufficient population immunity to avoid a fall resurgence, a winter resurgence? Our objective, our goal really at the end of the day is to put behind us having the kind of severe winter surges that we lived through this past winter. And I won't feel comfortable declaring victory until we're able to confront the fall and winter without encountering that. And I think achieving that victory is going to require that we achieve higher rates of vaccination across the state.
Thank you, Dr. Vanderhoff. That was our final question. Is there anything you would like to add before we conclude today?
No, thank you all very much. Again, really appreciate this opportunity. And I want to extend my special thanks to my colleagues. I really appreciate them taking time out of their busy clinical schedules to join us and to add their perspective from other specialties in other parts of the state.
Thank you all for joining us. Have a nice day.